Hey, one question we get a lot of is if my son or daughter is going to need braces, or just questions along to do with orthodontics, basically. The one thing that dentists or is recommended, and orthodontists recommend, is that your son or daughter have an orthodontic exam by the time they're 7 years old. So because there's variation in when teeth come in and tooth eruption for some kids. Some kids will lose their first tooth at 7, some will lose their first tooth at 5, so there is variation. So just what I'm going to go through, if you have any questions about it, ask us if we're your dentist, or ask your dental provider or an orthodontist, and they'll be able to give you some info on that. Basically, what we're talking about here is just having a basic ortho eval. The big thing in that is what's going on, or one of the big things is what's going on with crowding, and then the other thing is what's going on with the adult canines. And I'll show you what I mean by that. I've got an x-ray here where this patient it wasn't potentially looked at early enough, and the adult canine actually grew in to the over the other teeth there. So what can happen there is if it's not looked at early enough, they can actually have to have a surgery to pull that canine down. So by taking an x-ray at 7 years old, or 7 or 8 years old, a panorex, number one, we know which teeth, if any, are missing, as well as we know if there's any reason to look at those adult canines to make sure that they're in the right position, because things like this can actually be solved very early on and very easily, versus if they're left till we're teenagers, then it can involve surgical procedures and so on. So if you have any questions, comments, please send us a message, and we'll maybe, instead of just answering them with a DM, I'll just make a video on it. Thanks so much.